Andy,
Hi, nice to meet you.
Start off just by giving the update on George.
George North, obviously, precautionary, we had to put him on the spinal board. Symptoms on the pitch were as if he had a serious spinal injury, so we always take the precautionary route. And fortunately enough, the scans that we had in Ulster, we had a CT scan and an X-ray, and they were clear. So we're just dealing with some soft tissue trauma at the moment. Whether he turns around for this week, there's a possibility. We haven't ruled him out yet. So we'll see how he goes in the next few days, and obviously I can then update the coaches.
Certainly in terms of Six Nations, looking positive?
Oh, it's positive for Six Nations. So hopefully, all being well, he won't be far off.
I don't know how much you know about the Lee Halfpenny one. Is there other similarities with that? That obviously there are precautions taken?
There's always, you go through a protocol of if there's some symptoms on the pitch, you always spinal board someone precautionary because you don't want any severe injuries. And it's just making sure that they're doing right for the player. So we go from worst case scenario to best case scenario. So we always start off that it could be the worst case scenario. And fortunately enough, George wasn't. So we'll just see how he goes this week and hopefully make a call later in the week on him and update the coaches.
Andy, forgive me if I'm wrong, but were you on the pitch with him?
Yeah, I was.
Yeah. When you say the initial symptoms, can you just describe when you got on there what symptoms you were showing?
Any kind of spinal injury. If they have midline tenderness, so this is normal for any rugby player, if they have midline tenderness on palpation,
which means?
Pain at the back of the neck and the cervical spine.
Right.
So if you palpate that and they've got pain there with some other clinical symptoms when you ask them, then they could theoretically have a fracture of their neck. So we then go precautionary route rather than non-precautionary route. So symptoms on the pitch, he did have that, but fortunately enough on the X-rays and CT scans they were clear.
It was frustrating because when we watched the video a couple of times, it wasn't exactly clear.
He actually, when he landed, I watched the video as well. We always, as a medical team, always try and have a nose of the mechanism of the injury afterwards. So as he actually landed and hit the ground so his neck was down in flex position, one of their other players come and kneed him right in the middle of the back of the neck. So he had a double whiplash with a knee right on that part of the spine where he was tender. So that could have caused a significant injury, but fortunately enough, it didn't.
In a car almost.
Yeah, exactly. That's obviously.
What was he saying to you on the pitch? Because it must be frightening for a player.
It's frightening. The main thing is, from my point of view, I just try and reassure them, and I think that they know us now as a medical team well enough, and obviously when they're with Wales or wherever they are, that they take trust in you. So all I did was, you've got symptoms that I need to spinal board you, so just relax, and I'll just normal process, and that was it really.
Is it effectively what he's got though when you look at it now? Is it severe bruising? Is that what he's got?
Yeah, he's got severe bruising. He has got bruising, and some soft tissue trauma in there. But we know now from a spine point of view, it's all clear.
Was it traumatic for you on the pitch in times like that? You have to stay cool.
I've been 14 years in sport now, so 7, 8 years in rugby. So you sort of just go into a normal process. It's not really, you don't think of anything else, it's just part of your job. Like a player would, you don't think about going into tackles and you don't think about anything you do, you just go into a normal process.
Can you just give us a review on the injury ward? Will you sort of run through what the situation?
Obviously Reece Priestley's one of our long-term injuries. He obviously had the injury here, coming back from Wales, the first game back. He had an Achilles operation that week, a few days afterwards. At the moment he's going well, he's walking in a boot now. So he's in an air cast boot, walking. We take the wedges out every 10 days. So in 4 weeks' time he'll be walking normally. And we've already started the rehabilitation process. So he's in today, he's in the gym, doing stuff on his other parts of his leg than his Achilles. So he's already up and about and started his rehab, which is good. So normal situation with Achilles injuries, the one he's had is a 6-month situation. Anything before that's a little bit of a bonus, but sometimes they're a little bit longer. So 6 months a normal situation with what he's had.
And you worked in football, and there was like a few players who had Achilles things, struggled maybe to come back straight.
Yeah.
has the way we deal with them improved to such an extent now that you can come back almost as good as new?
Yeah. The surgery always changes anyway.
Yeah.
It's year to year, surgeons change, and it's your. There was an Achilles injury at my last club where I was at, and I did some research around the world, different surgeons and stuff. And fortunate enough, there's a very good surgeon here in Wales that we had operate on him. And it was a new technique called a percutaneous technique, which is basically non-invasive, so you don't open him up. And the surgery went well, and all you can do now is rehabilitate him, and hopefully things will progress properly.
Have you mentioned a torn Achilles without opening up?
You actually do a keyhole surgery rather than a big cut. So the bad thing about any Achilles operation is infections afterwards, and that stops that kind of situation. Obviously, I think Simon, in his interview to you when Reece first did it, he had that injury, and obviously it's a different operation than what he had a few years back.
He's got wedges in here, can't boot, does he? And you take
he has a wedge. So at the moment he's
built that more, and
he's plantar flexed, as we call it, but he's actually
Yeah.
bent up. So slowly we just stretch his Achilles by taking wedges out. And once he's at neutral, but he's already at neutral on the bed. Once he's at neutral, we start our rehab, start walking, start getting strength into him. Once strength, then we monitor GPS. We've got all his strength data. So we know what he can squat, we know what he can press, we know. And obviously it's up to us to get 90% strength back and start running him at the appropriate period. We will use the Auto-G machine, which we use at the RAF camp in Wales. So they're fortunate enough that we've got a relationship with them that we've used previously here. So we will use the Auto-G where we take off his body weight, so we can actually progress him 20%, 40%, 60, 80% body weight and get him back to full functional running.
That's what Jamie Roberts used, wasn't it?
Yeah. Well, I've used that for a few years, and it's a good progression because you can actually load up people.
You credit it with playing, I don't know, coming back 2-3 weeks earlier, so going back to October, September.
Yeah, you can run them a bit earlier. That's the thing, and if you run them a little bit earlier, you don't lose as much muscle mass. So you're actually, from a neural point of view, so from a capacity point of view, brain to body, you can actually get them functioning normally quicker. So that's the reason people say that it comes back quicker, but really you're actually doing a process, trying to beat a process from the brain. That's what you're actually trying to do.
Anybody else on your list, Andy?
Jordan Williams, obviously going well at the moment. He's actually back into non-contact training. So he had that shoulder anterior stabilisation. He went up to London yesterday to see the consultant. We had his operation done in London. So he's doing really well. So he's a few weeks off now. Start contact training in 2 weeks' time. Shingler is progressing well. Aaron. So he had a right groin problem, which he had from coming back from Wales with, which we were managing with. But he's just under a rehab thing. Again, he'll start running on Thursday. So he's actually progressing really well.
Maybe week, Saturday, maybe?
Possibly, if things go well, but we'll have to obviously see. So at the moment, we're just taking it day by day with him. We haven't really put a massive timescale on him, but he's actually running as of Thursday, and if he progresses running, hopefully he'll be back into training at some point next week.
Liam Williams was another one, was that?
Liam Williams, he had a concussion, so as the normal situation goes, he goes through a concussion protocol. Unfortunately enough, he wasn't ready last week, but obviously he's progressing well. So he's back into training. So as of
Ken was another one of his rules.
Ken Owens obviously had a bad rib injury. He's back into full training. Picked up a couple of weekend. Obviously, you've already mentioned George North, but Johnny Edwards as well. Picked up a hamstring injury. So he's got a tear of his hamstring, which we scanned yesterday. So he's going to be 4 to 6 weeks.